Please.
I'm Satyen Yadav. I'm the founder of India Millet Initiative. I have some observations as well as some of my concern. We are talking about the malnutrition, but we are never introducing in India this RUTF, ready to use theoretic food. Why we are not doing it? It's a policy issue. We should take care of it. The central government has said to the state governments that you handle it yourself. How it can happen? We are talking about such a serious issue, and we are shifting like we are playing table tennis. So we should be focusing on it, and the policy should be outlined accordingly so that we can really benefit. And I have another observation with reference to Dr. Sruti's presentation. I have been working for last 2 decades on developing various recipes which suits midday meal and ICDS programs. But government is again doing this all kind of adjustments. Sometimes they are supporting the public, sometimes they are supporting to pleasing the voters and shifting it to the Gram Panchayat, Gram Pradhans and all those people. There has to be a clear policy across the country. It can't be managed in pieces like they have announced this take-home ration, which is again being sold back to the people who are supplying it. So why we are doing all these things? Let's take it seriously. So this program is planned to have a serious discussion on the policy issues. That is another observation. And third is with reference to Ms. Gandhi's presentation regarding the availability of the seeds. So we have taken initiative with the university to produce certified seed, biofortified certified seeds, which will be available to all the people, and it is going to be certified seed. So there is not going to be any problem to release the subsidy. So that is again an important steps which we have taken together with this university, and we are taking other fortified varieties as well as. So I think within coming next 1 or 2 years, we will be able to replace the seeds with the biofortified seeds. So this midday meal and ICDS has to be taken very seriously, and there has to be uniform policies, and there has to be technological interventions, because it is not that the NGOs they can handle, the self-help group can handle. It is a high-tech technologies which needs to be produced, hygienic produce and products which can't be done by the common people. And if the government is trying to please the different sectors, sometimes the NGOs, sometimes the self-help groups, sometimes the contractors, sometimes the vendors. No, it's not a child's play. So let's take it seriously. Let's standardize the recipes with the help of NIFTM, IMR and other institutions, other stakeholders who are working, and have a uniform policy. This is what I want to say. And I request the rapporteurs and so that they can take it in the part of recommendation so that we should proceed further. Thank you very much.
Thank you, Dr. Yadav. The lady behind Dr. Yadav, you can hand over the mic to her, please.
Good afternoon, all the dignitaries and the esteemed scientists. So I'm Dr. Varsha from Indian Institute of Health and Health Management and Research, IHMR. I'm associate professor there. And I'm not from agricultural background, sir. Neither I have any millet background, but I'm studying millets from the point of view of health. And let me, in addition to what sir said, Professor Satyen Yadav, sir, that why we are traditionally forgetting, those areas where millets used to be grown, as I belong to the northern state, Bihar, from agricultural, one of the main agricultural state, and got married to Rajasthan. So I'm observing different part of Rajasthan, as my husband is a bureaucrat, and we have seen entire part of Rajasthan. So one striking difference which I am observing as a health person is that traditionally they used to have many millets, sorghum and many other crops which they used to have, and they used to remain healthy. Now they're forgetting. Even after, as we have seen Rajasthan, that, from yesterday's lectures also and today also, many of the speakers said that Rajasthan is agroclimatically quite suitable for millet cultivation. But why Orissa could implement millet mission and why we are not there. So, sir, as yesterday also I met Satyan Yadav, sir, and today also I asked him time that if we can do something, because I still feel that, the educated class like us and having some contact in the bureaucracy, because, I mean, in a lighter way now, though I'm saying, but we can actually, at least propose and make our voices heard at the policy level where it needs to go. So, sir, I mean, my basic question is, what is the difference between Orissa and Rajasthan, where, I mean, Orissa could implement it and we are forgetting our traditional crop. So this is one policy issue which we need to answer, and time has come. Yeah, thank you so much.
Thank you, Dr. Varsha. I am reminded because we get sattu in Bombay now. Sattu packed and we consume it in there. So, yeah, so we get sattu in Bombay. As consumers, we love to get these kind of millets in metro cities. So time has come for policy as well as consumer perspective for that. Yeah.
And I need blessings from all of you here that, if we are able to bring millet mission in Rajasthan, that's my dream now. I know I'm really...
Between you and Dr. Yadav, I think you should bring it. Between you and Dr. Yadav and everybody else here, you should start it. And I can guarantee consumers across the country for millets.
I really dream this thing that we should also have a next millet mission after Orissa.
Yeah.
That's all. Yes, the gentleman there, please.
Yeah. Good afternoon, everyone. I am Tapashchandra Roy. I am representing from Odisha Millet Mission. I have few questions in my mind since listening to this session today on the health aspects. Particularly, Madam Swati was focusing on Kodo millet, where I have questions that as we can find that Kodo millet is infected by Aspergillus and it then again it grows or produce mycotoxins and again CPA. So how in her project did she come across this, and if at all, if it's going to the consumer level, how we can deal with it in the coming days? Because as the climate change is happening, and we could find that if during the harvesting, if there is a crop Kodo millet in the field and if it rains, then these problem issues come arise and these toxins develop in Kodo millet. So how we can deal with that? That's the one question. Another question regarding pearl millet, I have that although Rajasthan, Gujarat are very well known in pearl millet, and the issue which I think the chattu or the take-home rations, they are thinking in these states where the self-life is coming into the picture, how they are going to dealing with that, because as the pearl millet, after processing or making the pulverizing, after 7 days it started deteriorating and the bitterness starts coming on. Then how the technology will be coming in the coming days, and how we are today in this great forum, how we can address that. Another question which is coming to my mind, that although we are talking about health issues, but when it comes to processing of the millets in that technology, everyone knows that millet is good, but how awareness we can create in the consumer level that the extent of processing also damages the nutrients part which is available in the bran layer. There are some states where the processing is very, they use some centrifugal conical processing where the bran layer is totally removed, but in terms of the religious or maybe in terms of festivals they consume it, but how we can address that and take that issue to the people again, that is coming to my mind. Although we had another question is coming to my mind, I think issue coming to thyroid. As you know, the thyroid issue is growing in a very fast rate in India, and a lot of myths are coming that the person who is suffering from thyroid should not consume millets, and whether it is a true, because lot of scientific data, since I am researching on millets since 8 to 9 years, I could not find the proper answer to that. Even if I am attending a lot of seminars all over India, but some says it's a myth, some says it's a it is a issue. Whether this can be addressed, these are my few questions. I think if this can be addressed in this seminar, I can take all these solutions to my state. Thank you.
Thank you, Dr. Roy. There is one last question before we wind up the session, the lady there in the corner, and then I hand over to Dr. Datta.
Hi everyone, my name is Pallavi. I head an enterprise called Millets for Health. We are a consumer brand and we have a lot of millet-based products. And we also do a lot of communication with our consumers on how to eat millets and how to cook with them, etc. So just one question and one submission. The submission is that to all of the eminent panelists and everybody who presented today, I think it's very important in our communication with consumers, with people where we are trying to promote millets, to put it forth as if it's, we shouldn't be promoting it like it's difficult to cook. I do cooking workshops and I tell people that it's extremely easy once you know the basic techniques. So I think all of us collectively should try to promote it in that way. Millet roti making is also very easy if we know the right technique. We don't need to add any wheat to get beautiful thin rotis which can be packed and eaten later also. But we all need to know it collectively and we need to promote it in the same manner. And I think, at the level of policy or at the level of states communicating, all of this maybe to some extent needs to be factored in. The second thing I have is a question. I think one of the panelists mentioned the presence of phytates in millets and the extent of soaking or fermenting, etc. that's required. My understanding on this, I don't have a dietetics background, so I would like to understand from all of you, doesn't cooking also address the issue of phytates? Is